So now you've had COVID-19 and your major symptoms have gone away, but you still notice that you do not feel quite back to normal. You notice that you still have some symptoms. Now you're getting really worried and confused as to what is going on. Do you want to know why that is? Join me in this video to find out why. So hello everyone and welcome back to my channel. I'm Dr. Geraldine. I'm currently a GP trainee in the UK, and in my channel I talk about wellness, productivity and growth, and today I'll be talking about tips that can help you recover after you've had COVID-19. Please subscribe to my channel if you haven't already done so, and don't forget to click the like and the notification button so you'll be notified anytime I upload a new video. So what is COVID-19? So COVID-19 is the term for the coronavirus disease which was first identified in Wuhan, China in 2019, and it can present with symptoms which include but not limited to the following, such as cough, fever, loss of sense of smell or taste, fatigue, body aches and pain, chills, headache, sore throat, reduced appetite. Other symptoms you could have include abdominal discomfort, diarrhea and vomiting, skin rashes and breathlessness. So remember that the fact you feel well may not necessarily mean that you haven't got COVID, because studies have suggested that people can have COVID-19 and not show any symptoms, and this can be tricky because they can easily infect other people without knowing it. If you want to know more details about COVID-19, I have uploaded a video about this and the link will be showing up here, so click on it and watch it and get a better idea about what COVID-19 is and how you can treat mild symptoms at home. So for some people who have had COVID-19, they will have symptoms that will resolve completely, usually in less than 4 weeks. However, there are two groups of people whom their symptoms may continue more than 4 weeks. So the first group of people are those who still have ongoing symptoms for more than 4 weeks and even up to 3 months. The second group of people are those that have COVID-19 symptoms which have gone beyond 3 months, and this is commonly referred to as post-COVID syndrome or long COVID. So when you have COVID-19 symptoms which have gone beyond 12 weeks, then you have this syndrome. In this video, I'll be discussing what you can do if you have post-COVID syndrome or long COVID. So what are the symptoms you expect to have if you have post-COVID syndrome or long COVID? So some common symptoms you could experience include fatigue or tiredness. In some cases we call it post-viral fatigue. Then you could have persisting cough which is not going away, ongoing shortness of breath, chest pain, persisting body aches and pains. Some other symptoms which you might experience include headache, on and off fever, low mood, palpitations like your heart is thumping. You could also have problems with sleeping and concentrating on things, and even have a bit of hair loss. So because people who have severe COVID-19 infection can develop organ damage, that means that they can also develop long-term effects of this organ damage, example the heart and the kidney. So how can you manage long COVID? So of all the symptoms that is associated with long COVID, I find breathlessness to be the most worrying symptoms in patients, and I'll be talking a bit more about it in this particular video. Now, like I said earlier, when you have breathlessness, do not panic. So try the following techniques. Number one is breathing control. This means that you have to breathe gently with as little work effort as possible. To know whether you are doing this well, put one hand on your chest and the other hand on your stomach. Try and relax and focus on your breathing. Take a slow, deep breath through your nose and make sure that your mouth is shut. So you are trying to get in as much air as possible to fill in your lung zones. And as you do this, you will notice that your stomach is getting bigger and expanding, and the hand that you placed on it will be moving. The hand you placed on your chest should not move if you're doing this well. Then breathe out through your nose and feel your tummy fall gently. If you are able to achieve this, then you are assured that your breathing is adequate and well controlled. You don't have to place your hand on your chest and tummy every time you breathe in and out. I'm just showing it to you so that you have an idea how you can know whether you are actually controlling your breathing well. So once you get the hang of it, try practicing it regularly so it becomes a part of you. So to control your breathing, breathe in slowly, fill up your lungs, and breathe out. So number 2 is breathing technique. Breathe out through pursed lips. So use the breathing control method. Sit upright, lean over slightly, place your hands on your thighs for support, breathe in gently and slowly through your nose, filling up your lungs. Make sure that your tummy is expanding as you do this, and breathe out through your pursed lips like you're blowing out a candle. So breathing technique during exercise. Try taking a breath before you are about to perform the activity that makes you breathless, and breathe out through your pursed lip while you are performing this activity itself. So make sure that you don't hold your breath in too long. The breathing can be done as much as your body can tolerate it and what you are basically comfortable with. Another thing you could do also is to use paced breathing. So for example, if you want to climb the stairs, you can regulate your inspiration and expiration according to the number of steps that you wish to take. So say you want to take 2 steps at a time before you become breathless. Breathe in before you take the steps and breathe out while you take the steps. So it may take a bit of time for you to get used to it, but with practice you're going to get there. So another example is if you want to get out from the bed, breathe in before you sit up and breathe out through your pursed lip while you're trying to pull yourself up from the bed. Remember not to hold your breath too long. The tip is breathe in before you make the effort, then breathe out while you're making the effort. Use this method if you're doing anything that makes you short of breath. It will help you with your breathing. And remember to regulate your breathing as well. Breathe in with rectangle in mind. Breathe in, breathe out. Breathe in, breathe out. So the normal respiratory rate in adults according to the Royal College of Physicians in UK is between 12 to 20 breaths per minute. So this means you are expected to breathe in and out, which is 1 respiratory cycle, between 12 to 20 times a minute. So this varies according to the age and the medical condition of the person. An average inspiration is about 2 seconds and an average normal expiration is around 3 seconds. Let me know in the comment section if you want to know why that is so. The third thing we are going to talk about is the positions which can help ease out breathlessness. So number 1 include leaning back on a solid surface with your feet apart like so. So number 2, you could lean forwards facing the wall like this. Number 3, you could stand with your hands on your waist like so. Number 4, you could lean forwards on a rail like this. And number 5, you can sit down leaning forwards on a table. So the 6th position is lying down on your side with a pillow as so. And more especially, take it one day at a time. Do not overstress yourself. You will recover with time. Hope you enjoyed this video, and do subscribe to my channel if you want to see me making more videos like this. Also comment and share and click the notification bell so you'll be notified anytime I post new videos. Bye now.